7:37 right now, and in our Health Watch this morning, we're taking a look at how women can make sure they're getting the proper medical care, especially if there's something that someone has neglected during the pandemic. So joining us right now is Dr. Matthew Saidel. He is the Chief Medical Officer for Women's Health Connecticut. Doctor, thanks so much for being with us. Doctor, first off, tell us why a lot of women tend to push off their visits, their routine checks. I know I certainly have done it many, many times.
Well, this is a special situation. We've been so focused on COVID for the last 2 years, and we're not really sure every day whether it's been 10 years or 10 weeks for this pandemic. We've lost track of time. So most women, when they suddenly realize that it's been 2 years since they've been in the pandemic and haven't been to the doctor, they're very surprised. It's almost as if time stood still. And also, we're so focused on everything else in our lives right now, and especially women are the caregivers for everybody else in their family, whether it's their kids, their spouse, their significant other, their elderly parents. And the last thing they think about is taking care of themselves. And then also, we're a little bit reluctant, even though, knock on wood, this pandemic is winding down. We're still a bit reluctant to go out of the house, and we may not realize that in places like in Women's Health Connecticut, in our offices across Connecticut and Massachusetts, we've done everything we possibly can to make this the safest environment for both our patients and our staff with regards to COVID and everything else. And so those reasons all combine, and suddenly people realize that it's been a long time since they've been in for their routine check.
Now, when it comes to annual visits, our annual visit for women to the OBGYN are crucial. It's something we do every year. But, you know, maybe one of those things that first come up when you're saying, oh, maybe I'll put that off. A lot of women don't love that visit, but those pap smears are so important. And what else does it help doctors detect?
Well, most of us have a long longitudinal relationship with our patients. We're used to seeing them all the time. And of course, we're always here during pregnancy as babies kept coming during the pandemic. But the annual visit is very important because most women between, let's say, the ages of 18 and 52 are seeing only their OBGYN on a regular basis, certainly more than see anybody else. We are the connection between them and the rest of their healthcare journey. We can connect them to the specialists that they see for other problems like cardiac diabetes and wellness and weight and nutrition and all those things. But also during this time, so many people have been lonely and depressed and a little bit burnt out. And that's something that we are attuned to, that we screen for, and we are able to also create warm handoffs to a mental health professional within 24 hours so that you can make sure that somebody is there during this time in which many of us have been very lonely. But it's really the main connection, and we're looking at blood pressure and blood work and all those different things, and health, wellness, and nutrition during the annual exam.
All right, now real quickly, I have to ask you, Doctor, Valentine's Day is Monday. What can our partners do to help make sure that we get the proper medical care?
Well, you know, most women, one of the things we hear all the time is, I don't have time to go to the doctor. I don't have time to do anything else. So one of the things you can do for Valentine's Day, what greater gift than giving the woman in your life the time, the space to take care of her health, and to help her on her healthcare journey, and to give her time to do whatever she needs to do, take over her responsibilities, so that she can go to the doctor, that she can do some exercise, that she can have some time for herself to help deal with the stress and the loneliness of this pandemic. But you as a partner can remind her, hey, you can take care of yourself. You've taken care of all of us.
Yeah, you just said probably the three most common words in my vocabulary, Doctor. I'm too busy. But like you said, we have to make the time to do it. It is so important. Doctor, thanks so much for being with us. Really,
oh, it's my pleasure.
For everyone
Thanks.
to keep in mind.